so much. Today, I'm very excited because of the prevailing partnership that we have with the Rotary Club of Kitgum. This partnership has been there over time. And I have to report that the Rotary Club of Kitgum has been supporting the health department in the areas of maternal child health and also in the area of wash. There are facilities in Kitgum over time which are a chronic problem of water. But with the good partnership, the goodwill that we have, and especially the goodwill on the side of the partner, that is Rotary Club, these facilities have been able to have improved water supply. And I must say we are very grateful to Rotary Club of Kitgum for the intervention. Today, I'm happy that we have received a state-of-the-art ultrasound machine from Rotary Club of Kitgum. This ultrasound machine has a very big strength because the strength of the ultrasound machine is based on what we call the probe. These particular probes ranges from 7 megahertz up to 11 megahertz, which means that we are able to conduct investigations across age groups, that is the pregnant mothers, the fetus that are always carried by the pregnant mothers, and then other groups like the men, because these probes can investigate small parts like the scrotum, the breast, the thyroid gland, which is something that has not been within our means of investigation. So this machine was requested by Kitgum General Hospital, and today we are delivering it to the hospital so that the different age groups that I talked about will be serviced and helped using this machine. As Kitgum District Local Government, we shall continue to partner with the Rotary Club of Kitgum to make sure that we improve on the health status of our people, especially for the pregnant mothers and the very young children. We are already working out modalities of how to support the neonatal intensive care unit at Kitgum General Hospital, for which, if that dream comes true, then we should be able to better some of the key indicators like perinatal mortality rates, neonatal mortality rates, which is actually now dropping towards the normal. But I believe with the holding hands together with Rotary Club of Kitgum, we should be able to reduce it further to acceptable levels.
So why are we giving this to the hospital? We have been partnering with the Kitgum General Hospital and the health department of Kitgum in a lot of areas. You may want to know that the Rotary Club has supported maternal and child health improvements in areas of Rome. We supplied motorcycle ambulances. We built sheds in the Rome Health Center where mothers who have come for antenatal care will care. We have done outreaches. We have done taken services to difficult areas where women in pregnancy will not be able to report to the health centers. We have also worked with support from Rotary International. We have also supplied piped water to what they call infection prevention control points in the labs, in the maternity wings, and in other areas where if there is no water, there will be increase in infection. You know, Umia and Yema Health Center 3 and Kitgum Matidi. This today marks another step in our partnership. We have given them this ultrasound machine and also a transformer to protect the machine, because this is a high volume machine and we don't want surges in power, electricity power, to destroy it. So we gave them a transformer worth 300,000 Uganda shillings. We also gave them disposable gloves and also wipes for newborn babies in the niche. We have given this because we have been working with General Hospital to improve figures related to maternal and child health. And we think, as the DHO has ably mentioned, this is going to provide the hospital with the ability to provide imaging interventions so that they can properly look after the mothers in pregnancy, the newborns, and also the mothers after the pregnancy. And we think that this is going to help the district reduce infant mortality of newborns and also maternal death. You know that high mortality, maternal death has been one of the major development problems, not only of Uganda, but of the developing countries. We are not stopping there. I also mentioned during the handover that we are working together with the hospital to get, through partners, to get up to 400 million shillings to support the neonatal intensive care unit, which right now was constructed to handle only 20 newborns at a time. But very many times it has twice that number. There are times when it has 30, there are times when it has 35 newborns. So we want to expand the facility and also tackle the problem of premature birth from the source. So we have written a project concept, and if we got the money, we shall be helping to improve training of the health workers, both in the village and the facility. We are going to be buying machines, not the niche ones, and we are also going to be conducting preventive education in the areas of the project. So we are going to move ahead. I'm happy that the hospital administrator has cautioned the people who are going to be working with the machines. First, to take good care of it. And secondly, because we have given it freely, we do not want to hear stories of the hospital charging anyone for the services that they are going to be getting at this one here. But as I conclude, I want to send out calls that as Rotary mobilizes money, mostly from the foreign sources, we, local people, should be getting thinking. Corporations, corporate people, people in the employment, farmers, we have to find ways of coming together with Rotary so that we can mobilize local resources and we see ways of also trying to solve our own problems with our own resources so that the resources that come from outside are only supplementing our own efforts. After all, these problems are our problems. So we should be calling upon young people like you, people who are anyone. Rotary is not for the rich. Rotary is for people who have hearts of service above self. So I call upon young people to come and join Rotary so that this thing that we are doing for humanity, we do them together. Thank you.
We are really very grateful in the first place to Rotary Club in Kitgum. They have been a key partner supporting us with a lot of equipment. And this morning again, we are pleased that we got an ultrasound machine. Ultrasound machine is a non-invasive diagnostic tool which is going to help us a lot to improve in our diagnosis, especially for diseases which maybe we are not able to see with our own eyes. We can use the machine to scan the abdomen and look at those organs wherever there is certain pathology involved in them. That will improve our diagnostic capability and will help our clinicians and doctors to be able to prescribe proper medicine for the management of our patient. I have a special message, especially for pregnant women. It is very, very, very vital that in the first trimesters, the first 3 months which you are pregnant, or when you miss a period, it is very, very, very important that you come to Kitgum General Hospital and you are supposed to get these free services of scanning. You know, when we scan at the early stage of pregnancy, we are able to detect almost 50% of certain abnormalities, genital abnormalities, and that would help us to design a proper way of how we can manage this kind of patient. So we are really very grateful to our partner, the Rotary Club in Kitgum. We know they're still doing a lot. They put for us a proposal to improve the neonatal intensive care unit, and we pray that the results and the outcome will be positive. That's the little I can say. Thank you so much.